Can a COPD chest X-ray look normal? Imagine going to the doctor feeling short of breath and wondering if your lungs are okay. You get a chest X-ray, but it looks perfectly normal. Can that really happen if you have chronic obstructive pulmonary disease? The answer is yes, it can. Chronic obstructive pulmonary disease is a condition that mainly affects the small airways and lung tissue. In the early stages, the changes happening inside your lungs might not be visible on a standard chest X-ray. That means even if you have symptoms, your X-ray could look normal. It's because the early damage is subtle and doesn't cause big enough changes to show up on the images. As COPD progresses, the X-ray usually starts to show some telltale signs. These include lungs that look larger and darker because of trapped air, which is called hyperinflation. You might see a flattened diaphragm, which happens when the lungs overexpand and press down on the muscle that helps you breathe. The space between your ribs may also look bigger because your lungs are expanding outward. In more advanced cases, the X-ray can reveal other features like reduced lung markings, which indicate destruction of lung tissue and loss of elasticity. Sometimes you can see bully or air pockets, especially in emphysema, a type of COPD. But here's the key point. These signs are usually seen only in later stages of the disease. So, if your X-ray appears normal, it doesn't mean you don't have COPD. Early on, the damage inside your lungs might be too small to detect with just a chest X-ray. That's why doctors often use other tests like spirometry, which measures how well your lungs are working, or CORT scans that give a more detailed picture of lung structure. Chest X-rays are still useful because they help rule out other problems like infections or heart issues that can cause similar symptoms. They are quick, safe, and accessible. But remember, they have limitations, especially in early COPD. Relying only on an X-ray might delay diagnosis. That's why your doctor will consider your symptoms, lung function tests, and sometimes imaging studies to get a full picture. In summary, a normal chest X-ray does not rule out COPD, especially in its early stages. It's just one piece of the puzzle. If you have symptoms like shortness of breath, cough, or wheezing, don't hesitate to ask your healthcare provider about further testing. Early diagnosis can help you manage the disease better and improve your quality of life.